Alright, so the next stage in the neurophysiological assessment is the stress movement patterns. And we're going to be looking at both rotations and then from there the quadrants, depending on which rotations are affected. Could you put your hands up like so? So what I'm going to do is I'm going to generate an eccentric contraction in his muscles by pushing him from an end of range. So let's turn you to the right there. So I'll be pushing him from right rotation to left rotation, causing him to contract his right rotators. And all I'm going to do initially is just feel for how rapidly he responds to my pushing. I'm going to give him plenty of opportunity to resist me. I'm going to push you, all right? Don't let me move you. I just push. And there's an immediate and strong response to that. So we'll take him the other way now into left rotation and push him from there and see what this feels. You ready? I'm going to push on you. Okay, don't let me move you. And there's a give, right there. Now, I can show you what happens if I push him through this, and you'll see both rotations. So I'm going to be pushing him from left rotation into right rotation, and don't let me move you, and you'll see him suddenly give way there. If I take him the other way, which is the stronger of the two movements, ready, don't let me move you, you'll see that it's a much more contained contraction and it gives gradually. And this is telling us, basically, that he is weak when I push him into right rotation. Then is right rotation weakness. So I'm going to be looking at two quadrants, right rotation extension and right rotation flexion. I'm not in the least bit interested at the moment in left rotation. So our test for right rotation extension will have him start at left rotation flexion. I'm going to push him into right rotation extension. Don't let me move it. And again, I'll be feeling for that initial resistance that it's not there. In fact, let's just stabilise him a bit more there. Don't let me move you. And just give him way. Now if I push him through this, you'll see what will happen. Come down. Don't let me move you. And I'll push him up. And there's a give. Okay, now we're going to check right rotation flexion, simply for a comparison, but also there may be two quadrants affected. So we'll take you back into this position there, which is left rotation extension, and I'm going to pull him down into right rotation extension to see how that feels. Ready? Don't let me move you. And there's a good strong reaction. So if I really force him through this, I really can barely get him to move, and then when he does move, it gives way gradually. So what we found is that his weakness is from left rotation to right rotation and extension. So it's when I push him up and into that direction is where he is found to be weak. Okay, what we did first off was look at the multifidus on the right side. And they were all okay. So given that he has got a weakness, one of these multifidus must be abnormal. So I'll come down and palpate the left side of the spinous processes now, the changes in multifidus bulk, and I find it right there at about L5S1, while the other side is normal. The left side of L5S1 is deep, so there is bulk loss, either hypotonicity or atrophy, or a combination of both. Okay. I've got a thing as well. Okay. Okay, so we found decreased bulk L5S1 on the left of multifidus. We're going to try to improve things both in the bulk and in the stress movement pattern by increased proprioception into L5S1 and decreasing the reflex inhibition that is there. If there is actually atrophy here, it will make no difference to this in any significant way. So all I'm going to do is come onto L5S1, L5, and basically do some fairly sloppy PAs. So we're going to wobble it basically, and we'll do this for about 7 or 8 seconds or so, and then we'll recheck the bulk and the strength of the movement pattern. So palpating for bulk now, and I know I'm cheating a little bit, but there is an increase in bulk. It's not as good as the other side, but it's better than it was, which is pretty much all you can expect after a few seconds of wobbles. And then we'll check on his stress movement pattern again to see if that's improved. So we're going to check this out and see how we've done. Let's get you down into the beginning of range of right rotation extension, and we'll just try to see what the response is initially and see if that's any better. And don't let me move you, ready? Alright, don't let me move you. And it's much stronger, so let's see what happens when I try and break him now. Don't let me move you. I can barely shift him. He's actually stronger now than the other rotation extension. We're going to treat this, and we'll be treating it with PNF patterns basically. And the pattern we're interested in, because this is what we found with DePaul, is this pattern from flexion, left rotation, into extension, right rotation. And this is the one we'll be working with primarily. So I'm really not interested in any other movement other than backwards and to the right. Now, to get him going, I'm going to do this essentially passively to begin with. He's going to be holding his weight up, but I'll be moving him. So we'll do a passive movement through the range, and then I'll get him to basically come on board and assist me. So it's an active assisted movement, and then we'll switch to a concentric resisted movement, and then we'll break that and we'll talk about it and then come back and do the more complicated techniques after that. So essentially what I need you to do is just feel this movement we're doing now, okay? So it's from there to there, and we're taking you up and back. All right, I'm going to move you like this, and I want you to gradually come in with me. From there through here. Good. And then I'm going to add a little bit of resistance onto the movement. At the arm there, which I want you to bring a little bit closer to your side. Don't stick them out that way. Good. So I'm going to add some resistance onto your left elbow and to your back shoulder blade. I just want you to gently push into my resistance, all right? And this one. Just gently push into it and relax. Relax, relax. Push up again, push into me and relax. Push into me and relax. Push into me and relax. And as I'm doing this, I'm basically paying as close attention as I can to the pattern of the movement and the degree of resistance. And it's very important that you actually do place your hands in the right place. And if I shift my hand quite deliberately, you should see the whole movement pattern start to change, and we'll do it the next time around, and from there, and you can see immediately he's confused and it's not going where I want him to go. So again, back onto this, and he's back into it again from there. And relax. Good. So it's a concentric contraction up, and then I basically have him relax, and I'll just guide him back down to where we started from. Okay, so we've done concentric work. Let's have a look at the eccentric work, and then afterwards we'll put them all together. So again, the starting position will be left rotation flexion, but now I'll be pushing him into right rotation extension. So my hands need to be able to push. So I've got one hand on his shoulder, the other hand will come down just below the scapula, and basically my instruction to him will be, let me push you but give me some resistance. And there. And there. A little stronger resistance. Good. A little less. Until we get the right one, which is about there. So all I'm doing is basically pushing him back and bringing him forward again. And just being very careful about the direction of my push now. A little bit more resistance, a little less. Good. And once we get it, we just keep going. From left rotation flexion through right rotation extension. And you've got to be very careful about feeling for the first evidence of fatigue, and there it is, right there. And he just started to come up, and as he came up, the shoulders span that way rather than come over. So at that point you stop the exercise, give them a chance to recover. Maybe have a second look at the muscles to see if they need more stimulation. But if you keep on doing this, when the pattern's wrong, you'll simply re-educate a poor pattern. Alright, so we've got concentric work, eccentric work. What we're going to do now is mix it up. So we're going to try and, as much as we can in the clinic, simulate external conditions by having him perform different types of contraction at different rates in different directions. The direction I'm still mainly interested in will be this one, right rotation extension, but while we're having to recover downwards, it's actually easier for both of us if I make him work on the way down. It also uses the time a little more efficiently by working on the other movement, but his movement that needs re-educating is still the same. Okay, so here we go. You do need to come up with a communication system here. The one we're going to use may not be the one that you choose for your patients, whatever you're used to, and it takes time to build up this communication, which is what you'll be doing during the concentric and eccentric phases of this. Essentially though, if I say to him don't move, I actually do mean that I want him to move, but I'm trying to produce an eccentric contraction within him. If I say push down, he'll push concentrically downwards. If I say pull up, he'll pull concentrically upwards. So if I say don't let me push you down, it'll be an eccentric contraction downwards. If I say don't let me push you up, it'll be an eccentric contraction upwards. Okay, now, given that we haven't had too much chance to actually work this out between us, let's see how we do. So we're going to come down to the start position, which is, again, flexion, left rotation. And it'll be don't let me push you up, and push down, and push up, and push down, and don't let me push you up, and don't let me push you down. Not too much resistance. Push up, and push down. Don't let me push you up, and don't let me push you down. Push up, push down. Don't let me push you up, push down. Don't let me push you up, pull down, push up, pull down. Okay.